Hello, my name is Tamara. I'm a student at William Patterson University. I'm going to be recording a practice physical exam on my sister here. Do I have your consent to record this video?
Yes.
Okay, so we'll get started. So, hello, my name is Tamara. I'm going to be performing your physical assessment today. Do my hand hygiene. First, I'm going to be doing a general assessment on you. I'm going to be looking at your overall state. So you are well dressed. You're able to answer my question, yes or no. And your skin color is normal for your ethnicity. And then also I'm looking at your symmetry of your face. Everything looks symmetrical and you are alert. So I'm going to go ahead and look at your hair. So I'm looking at your hair. You don't have any infestations, no lesions, no balding spots or anything like that. So that's perfect. And then I'm looking at your eyebrows as well. They're equal and no patches of hair are missing. And I'm going to ask you to raise and lower your eyebrows. And then open and close your eyes. And also make a frown and a big old smile. Okay, perfect. So that's measuring cranial nerve number 5 and 7. And then I'm also going to ask you to close your eyes. And then just tell me if you can feel this on equal on both sides.
Yeah.
And up here?
Yes.
Okay, perfect. So that's measuring cranial nerve number 5 as well. So then from there we can, I'm going to palpate your temporal and masseter. So go ahead, open and close your jaw. Okay, perfect. So there's no clicking, which indicate no dislodgement or any TMJ dysfunction. From here we can move on to the eyes. And from the eyes, I'm going to be looking first, inspecting, looking at the symmetry, which her eyes are symmetrical. There's no signs of ptosis or no drooping. And I'm also looking at her eyelashes. There's no signs of infestation or crust or redness or inflammation. So that's good. Now I'm going to be checking her actual visual acuity using a Snellen chart. So I'm going to have you read first off the nearsightedness. You could read that line right there for me.
LTFPH.
Perfect. Now we'll do a far distance test. Read it again.
LTFPH.
Okay, perfect. And then going back to the eyes, I'm also going to be having you follow this pen light right here. I just want to take a look at your sclera, which are white and moist. And then I'm also going to have you look to the side just so I can look at your conjunctiva, which are also pink and moist. And while I'm doing this, I'm going to be checking your extraocular movements, which is going to be testing cranial nerves 3, 4, and 6. So just want you to follow the tip of my pen light. So we're going to go from side, up, down, back to the center, up, down, back to the center. And this is testing any nystagmus and making sure there's no extraocular movements. Keep following it. I'm going to bring it to the tip of your nose and back. So perfect. She's able to have convergence. And then from here, we're going to be testing, making sure that you have your eyes are pupil round and reactive to light. So looking at the tip of my finger, your pupils are round. I'm just going to shine the light on this eye and it's constricting, perfect. And on the other side, constricting, perfect. So her eyes are equal, round, and reactive to light. And then from there, we're going to be doing a periphery vision test. So I'm going to have you cover one of your eyes and then look at me right here. Look at the tip of my finger and only look at the tip of my finger. You're going to use your peripheral vision. I'm going to either hold 1, 2, or 3 fingers up and you tell me which one you see. Okay?
1, 2, 2, 3.
Perfect. So you could do the other side then, cover your eye, and then we'll do it again. Keep looking at right here.
1, 2, 3, 2.
Perfect. So that's testing your peripheral vision. And then from here, we're actually going to use our ophthalmoscope. I'm going to be taking a look into your eyes, making sure that you don't have any deformities inside your retina. So go ahead and take a look of an object at the other side of the room so that your eyes can fully dilate as much as possible. Now I'm going to be taking a look inside, and I I see that your eyes have a red reflex, your optic nerve is sharp, and you have no retinal abnormalities. And I'm going to do the same thing on the other side. Same thing, sharp optic nerve, no retinal abnormalities, and a red reflex. Okay, so that's that. And then from there, we can move on to the ears. So now for the ears, I'm going to do an inspection. I'm going to pull your hair back just to take a look. So looking at her ears, I don't see any drainage. They look symmetrical. They're not red, not inflamed or anything like that. So I'm going to pull on your pinna and tragus and just tell me if you have any irritation or pain.
No.
Okay, so since we don't have any of that, I'm going to go ahead and take a look inside. So using my otoscope, I'm going to take a look inside her ear. I'll go on this side just to show. Turn your head that way. And because she is an adult, I'm going to be pulling the pinna back and up. I'm going to be looking inside, and I see her ear is not red, it's not inflamed, it's not swollen. Her tympanic membrane is intact, and it's a pearly gray color with no discharge. Same thing looking on the other side. I'm going to pull the pinna back and up. Same thing, tympanic membrane is intact. It is a pearly gray color, no discharge, and no redness, no signs of trauma. Okay. And now from here, we're going to be using our Weber test, which I'm going to be making this sound, putting it at the top of your forehead, and then just tell me if the sounds equal on both sides.
Yes.
Okay, perfect. So that's a good result. And now we're going to do the rhyme test, which I'm going to make the sound, put it in front of your ear, put it on the bone behind your ear, and you tell me if you hear both of them and which one sounds louder.
Yeah, I hear both of them.
And which one sounds louder?
They sound the same.
The one in the front sounds louder?
Oh, yeah, the one in the front.
Okay, and I'll do it again on the other side.
Mm-hmm. Yeah. I hear both. The one in the front sounds louder.
Okay, perfect. And then the last thing for the ears is we're going to do a whisper test. So I'm going to have you cover one ear. Doesn't matter which one. And now I'm going to go on this side, and I'm going to whisper a word to you.
9.
Perfect. And then we'll do the other one.
Cat.
Okay, perfect. So that is that one. So we did the ears. Now we're going to move to the nose part. So we're just going to take a look at the nose first, not touching it. I don't notice any visible fractures or abnormalities or deformities, and everything looks pretty straight to me. After that, I'm going to take a look inside with my otoscope, lifting up the tip of your nose just to get a clear look. And I noticed that there's no major discharge, no bleeding. The airway is patent. Your turbinates are moist and pink. And everything looks good so far. And then I'm also going to be checking your sense of smell. So I'm going to have you close your eyes. And I'm going to place something in front of her. And she has to tell me what you think it is. Place a smell.
Cinnamon.
Yep. You got it right. You can open your eyes. Okay. Now I'm just going to palpate your sinuses, and you just tell me if you feel any pressure or pain while I do that.
No.
Okay, and perfect. And then if we wanted to test also for the sinuses, we can use the light test to hold up the light to her sinuses here and make sure that there is a red glow. That would mean that your sinuses are patent and not obstructed with any mucus or drainage or anything like that. So next thing we're going to do is check the mouth and the throat. So I'm going to do a external visualization first. Looking at her lips, she doesn't have any bleeding or crusting. Her lips are pink and not pale or blue, so we have a good sign of perfusion. I'm going to ask you to open your mouth as much as you can. And I'm going to look inside with my light and see that her buccal mucosa is pink and moist. Same thing with her soft and hard palate. Her tongue is pink and moist with no signs of any infection or fungal infestation. And then I'm going to have you look down a little bit so I can just look at your gums. Gums look good. And then stick your tongue out as far as you can so I can see the back of your throat. And your tonsils are symmetrical and they're not enlarged, and you have a patent airway, no cobblestoning, and everything looks pretty good. So from here, then we're going to continue on with a taste test. So I'm gonna have you close your eyes, and I'm gonna give you something. I want you to tell me if it's sweet or salty. So stick your tongue out. Go ahead. You can hold it.
Sweet.
Yeah, it's sweet. Okay. And then for the last thing, I'm going to, and that was testing cranial nerve 7 and 9. And then the last thing is I'm going to pretend to gag you. I really would do it with like a tongue depressor. You can open your eyes. And then that would trigger the reflex for your gag, and that would be cranial nerve 9 and 10. So so far we did general, head, ears, eyes, nose, and throat, and then I'm going to go to your neck. So from your neck, we're going to be testing first visual inspection, make sure that everything is symmetrical, that I don't see any thyroid enlargement. Everything looks pretty good, no tracheal deviation. And then I would come behind the patient and then feel to make sure that everything is symmetrical. Same thing with the thyroid. And then one at a time, I'm gonna palpate her carotid artery, which is perfect. I feel it and I don't feel any thrill. Okay, and then next what I would do is get my stethoscope. And I'm just going to listen on the thyroid and the carotid arteries and make sure that I don't hear any bruise. Okay. Perfect. So since we've done that, we already looked at the thyroid. So now I'm just going to look at your, see if I feel any lymph nodes. I'm going to check right here behind your ears, behind your jaw, going down. So clavicle, don't feel anything. Nothing there. Okay. And then from there, we're going to be checking the chest. So we can start with the back. So I'm going to have you turn a little bit. Just like that is fine. Yeah. Perfect. So first I'm going to start with an inspection, making sure that, sorry kitty, making sure that everything is symmetrical, that there's no visual deformities that I can see right now. And then from here, same thing, I'm going to use my stethoscope to go ahead and listen to her breath sounds. Take a deep breath in and out. In, out, in, out, in, out, in, out, in, out, in, out, in, out. Okay, so everything sounds clear, no adventitious lung sounds. So from here, I'm going to ask you to take one more deep breath in and out. And then I'm feeling for any tactile fremitus, any vibration, which I don't feel that. And then from here, I'm going to go and do some percussion. Okay, and then everything is resonating well, so there's no dullness. So everything looks good here. And then I'm going to ask you to sit forward again, and then I'm going to be looking at the anterior chest now. Same thing, looking for any abnormalities right off the bat. Don't see anything, everything looks symmetrical. And I'm just going to be taking a listen again. I'm going to have you take those same deep breaths. One. And out. Okay. And again. And again. Again. And again. Okay. And that's for that one. And then at some point while I'm doing this assessment, I'm going to be checking her respiratory rate and rhythm. I don't want to tell her so that she doesn't psych herself into changing it. And then the last thing I'm going to do is palpate again. I'm sorry, percuss again. And then same thing. So we have resonance and no dullness. So finally, the last thing we're going to do is the cardiac assessment. So I'm going to have you lay back. Actually, put your head here if you can, please. Here, I can take that one. Okay, and so right now, I'm looking at her neck. I don't see any jugular vein distension, which is a good sign. If we would, then we would measure it. And then I'm just going to go ahead and listen to her heart valves. So the first one I'm going to do is listen to the aortic, which is going to be on the second intercostal space at the right sternal border, which sounds normal. Then I'm going to listen to the pulmonic, which is at the second intercostal space in the left sternal border. Perfect. And then I'm going to listen to Erb's point, which is at the third intercostal space, medial sternal. Then I'm going to listen to tricuspid, which is at the fourth intercostal space, left sternal border. Then I'm listening to the apical point or the mitral valve, which is at the fifth intercostal space, midclavicular. And everything sounds good. No extra heart sounds. S1 and S2 is present. And then, no extra heart sounds from there. And then from there, we're going to listen to her arteries. So I'm going to start with her aortic valve, which is her aorta, which is going to be right here. Abdominal aorta, which there's no bruit. Then I'm going to listen to her iliac, right and left bilaterally. Same thing, no bruit. Renal arteries, bilaterally, no bruit. Then we'll do her femoral artery, right and left, no bruit. And then from there, we're just going to check her extremities, pulses. So I'll be doing radial pulse right here, which you can feel it right away. It's a 2+ with no thrill felt. And then same one on the other side. +2, no thrill. And we'll look at her pedal pulses. Same thing, +2 with no thrill.